Hong Kong's COVID tally went up by almost 1,000 today, slightly lower than yesterday. Outbreaks in a growing number of elderly homes continue to put authorities on edge. Wenna Wang has the latest.
Hong Kong's daily tally went down slightly today, landing at 986 cases, compared with yesterday's over 1,000. Outbreaks in a growing number of elderly homes continue to be a big source of worry for health authorities. Newly discovered cases today include an employee at Tang Tat Home for Elder in Kwai Chung, who tested preliminary positive for COVID, and a kitchen staffer from the Ho Yok Ching Willow Lodge in Tai Kok Tsui. At One Lun Home for Elderly in Sham Shui Po, 3 other cases were discovered in residents. An elderly man who lived there died in hospital earlier this week after testing positive for the virus. Authorities are now considering evacuating the entire building and sending everyone into isolation. There was also an additional death this afternoon, a 94-year-old unvaccinated woman who tested positive for the Omicron variant. With the medical sector under increasing pressure as local cases soar, suggestions are coming from left, right, and center on how to deal with patients and close contacts.
Currently, we are very closely monitoring the situation of how the epidemic is developing, and also we are going to strategize how we handle people who are infected or close contacts, the environment for their treatment and isolation or quarantine. So we have already implemented modification in our measures in, for example, introducing home quarantine for close contacts and also family members of close contacts, and also using Penny's Bay, which is usually previously a quarantine facilities to house patients with mild symptoms. So we are gradually modifying the hardware that we have to accommodate different kind of people in need.
Health authorities again called on people to get vaccinated and go for the 3rd dose if they're eligible. Wenna Wang, HKIBC.